Good day. My name is Carbonilia Zarjones O, and I will be doing the actual cord care and assist nurse skills checklist. Now, for this checklist, we're going to be dividing it into three categories: the student actual nurse, next is the student assistant nurse, and the third one is the student cord care nurse. Now, for the first step, or the first category, we're going to be doing the student actual nurse. For the first for the first step in the checklist is we're going to be monitoring the labor through pictograph. We're going to be checking the frequency, duration, and the interval and intensity. Next is we're going to be bringing out the delivery room surgical equipment such as the instruments such as the scissors, one scissor, two curved pin, one needle container or holder, and one tissue forceps. The purpose of this is we're going to be using this for the procedure in the next steps. Next is we're going to be collecting and checking all the materials needed for delivery. In case these materials have been used, the purpose for checking it is to avoid any um, malpractice or infection if the surgical materials were used or the wrong materials. Next is we're gonna perform the incisional episiostomy during the delivery with the materials used. Next is we're going to pull out the entire body of the newborn, and we're going to put the baby in the mother's breast. It's one of the steps in the I IENC, which is in the unang yakap, where we put the baby in the chest of the mother. Now we're going to be identifying the signs of placental separation, and you can see, and when we see it, we would see there will be different variations and different types of placentas that we're gonna identify the signs of placental separation. Next is we're gonna assist if episiotomy is needed during this checklist. And after doing this incisional surgery to bring the baby out, we're going to be cleaning the perineal area. The purpose of cleaning the perineal area is to avoid any infection and to clean the site. And we're going to be placing an adult diaper on the mother because of surgery, since cutting it from the vaginal to sideways or in the middle. And next is we're gonna check on the delivery room instruments, and we're gonna perform asepsis. Of course, we're gonna clean our hands, the site area, the materials, and after that we're gonna disinfect the room and everything to make the place clean and free from any bacteria and asepsis. And the next category that we're going to be explaining about is the student nurse assistant. So the first step for the student nurse assistant should be you should monitor the mother's vital signs and the fetal heart tone of the baby. Where we did it in the previous checklist, where we're going to be checking on the side of the midline between the syphis and the fundus, the midline, and we're gonna check on the mother's fetal heart rate, and just to check if the baby is still um is still heart is beating well, as well as for the mother. Next is we're gonna be positioning our client in the part we're gonna be positioning our client on the table, and from there we're gonna assist the husband if the if the if the if the mother in delivery wants a support system to be present by her side. We could command the husband to come, and we should assist to come and be by her side. We can assist the husband by putting him a cap, a mask, and a gown to avoid any infection or for proper asepsis as well. Next is we're gonna coach down the proper breathing technique. and the bearing down technique on the mother. So we're gonna teach the mother how to breathe properly as she's conceiving. It's just to help her relax, and not it as well as though the husband might be there to help on relaxing, as well as the breathing technique should also work. And upon delivery of the baby, we should note the time of the baby when it went out, and we shouldn't forget the placental explosion. We should also note that down in the in the rec- in the charts. Next is we're gonna prepare to administer oxytocin as administered as request as ordered by the physician in charge. Next is we are gonna we're gonna clean the perineal area, and of course we're gonna have to place the adult diaper on the client um, since fresh from the surgery, and we're gonna bring the mother client to the ward safely, and we're going to be continuously monitoring the mother's vital signs and the baby's vital signs for 15 minutes until stable. This purpose is to check if there's any um feedback, or um if there's any things that still needs to be done. So we have to check until all vital signs until everything is back to stable. Since there might be uh cases wherein blood can gush out, heart rate will continue beating, the baby gets too cold, so we'll have to monitor for like at least 15 minutes before everything is stable. And the third category that we're going to be doing is the student cord care as a nurse. The first step is we're going to call out the time and the sex of the baby. So we're going to be calling out the time the kid went out and the gender. Next is we're going to deliver the mother in we're going to deliver the baby to the mother's abdomen or chest, abdomen or in her arms. This is one of the protocols in the Unang Yakap, which is the IENC. Next is we're going to thoroughly dry the baby with a warm towel. First, the purpose for this is to not only for a rapid assessment, but is also to help circulate the baby and to dry the baby up to avoid to avoid hyperthermia or any infections. After drying the baby thoroughly and having a rapid assessment on the baby, that's when we're gonna place the baby on the mom's chest or abdomen for early skin to skin contact. Not This helps in provide a better bond between the mother and child, and at the same time, according to what I read from before, it also helps the child. It also gives the mother and child also can share heat to make the baby warmer. Next is sterile cord clamping and cutting. Now, in this procedure, we do not have to cut the cord right away. First, we're gonna have to uh, clamp the first 2 centimeters from the umbilicus. That's the first clamp. Then we measure another from 5 centimeters from the umbilicus, and that's when we cut it. But we have to wait for the pulsations to avoid hemorrhages from the baby, or yeah, hemorrhages. Now next is where non-separation from baby to the mother. So the purpose of this is you can yeah, again, not apart from the fact that it's a mother bonding technique, but in this way it can also help in the initiation for breastfeeding, wherein the baby can find its way to the breast, or we can assist. And the purpose of this is when the moment the baby gets the first breast milk, it's like technically the first immunization for the baby, because natural it's like the first natural immunization for the baby, since milk contains nutrients that is healthy for the baby, which can fight against infections and can help the baby grow. Now, upon that, we have to all after doing all the procedures, we must have to also remember that we have to um, perform eye care, wherein we put this sort of a cream in the ayan, F3 OE OU in the eyes about 1 centimeter. Next is Next is we're gonna have to be putting on we're gonna be have we have to get the vaccines needed for the baby, which consists of vitamin K and hepatitis B shots for the baby. And we're gonna we're gonna be injecting the the vaccine on the right deltoid of the baby, and we're gonna be having measurements with we're gonna perform also anthropometric measurements on the baby, and we're gonna be explaining. We're gonna have to first also explain to the mother why we have to vaccinate this baby. Why we have to vaccinate the baby. We have to put ointment in the eyes so that the mom can so that the mom will not panic. At the same time, it will help her also cooperate. And we're gonna have to take the newborn's initial vital signs for charting as well. And the moment we get all the data from that, we're gonna have to document everything. Next is most importantly is we're gonna have to minimize the handling of the newborn, unnecessarily handling, like such as getting the baby and shaking it around. No, the baby must stay with its mother. Next is we have to keep we have to we have to room in with the mother. That means we have to take the baby and let them stay with the mother in a comfortable, sterile place. Um, and of course, the moment the baby is still, even though the baby is still having the skin to skin contact with the mother, we should apply a bonnet to avoid hypothermia or hypothermia or the baby getting any cold. And we should encourage as well not to wash the baby within 6 hours or 24 hours to avoid again hypothermia or infections. And we should encourage the mother to continuously breastfeed. It would be good for like at least 6 months until they're able to start eating solid foods at around 2 years old, because breast milk is still the natural nutrient for us babies. And we should always put the baby in a warm room temperature to avoid again hypothermia and all. And that is the checklist. After doing all the three procedures, after doing all the three categories, we're gonna have to document everything. We're gonna have to perform the proper sterile techniques as well, and we're gonna have to assure the client that all the data that we have gotten from the procedure will only stay between us and the medical team. Thank you.